Thank you very much for coming today. We have what we think is a real good proposal to show you that we're considering for retiree health care. We have some people here today. You all know Donna Height. She's been with the conference about as long as anybody. And she's the registration desk there. Courtney Williams, who works in my office, in the treasurer's office. Don Sperber, who you all know, he's a member of your conference board of pension and health and has been the retiree representative on that board, and we'll be sharing a few words with you at the conclusion of this. And finally, we have Barbara Hora, who's from the General Board of Pension and Health in Chicago. She is our conference and bishop liaison who works with us on a daily basis almost, keeping us on line with our health insurance and pension program. So you'll be hearing from her about halfway through my presentation, and you'll be ready to hear her after you listen to me for that long a time. With that in mind, let me get started. We're going to start off with a kind of a historical review of where we've been. We're going to share with you, and this is the major thrust of the meeting today, share with you a plan of action in terms of a new approach to retiree health care, one of which is consistent with the charge that we had from your Board of Pensions and Health to keep you whole or to cause you no harm. When we approached this topic, one of the primary guiding factors in this was the fact that we did not want to cause any loss or harm to any retirees as far as any change of plans, cost factors, or anything else. So that was a guiding factor. We'll then move on to a explanation of what you'll come to know as Extend Health. We'll stop at that point to allow you to ask some questions, express concerns, and based on yesterday, we feel we'll be able to answer most of those. We'll again review the packet supplement. We'll have a little more information to provide you with that. Allow you time for additional questions and concerns, and then provide you with a place where a website that you can log on to get specific information relative to what you're hearing today. And in addition to that, we're going to provide you a place on our conference website. It'll be a blog where people can, like yourself, can, as you go through this learning experience, ask questions and we'll respond to you, and then everyone can see these. You can log on to the site at any time to keep updated on that information. So that's what we're going to do today, okay? Most of you probably recall last fall, in the October-November timeframe, we sent out a survey to all the retirees asking some questions. And one of the immediate responses and reactions to that was one that we didn't expect and was not intended. There was a concern that we were going to change everything right then, and that we were changing it because we needed more money for new church development and we were going to take it away from retirees. That was not the intent. We tried to word it so it didn't come across like that. But if it did, I want to apologize because I was the primary writer of that, and that was not the intent at all. So hopefully today we can clear up that and we can show you more specifically what we're trying to do to continue and honor the obligation we owe you as retirees, and to do it in a way that's beneficial to you and at the same time that it's beneficial to the conference. You've heard us say before, and right now the retiree health care plan subsidy, those of you who retired in pre-82 with more than 20 years of service, the conference subsidizes your costs 75%. Those of you who retired in pre-82 with less than 20 years of service, we're subsidizing you at 50%. That constitutes 17% of our budget, or almost 1/5 of the conference budget. And admittedly, that's a concern for us. As church revenues, particularly during these recent economic times, as church revenues have stabilized and as healthcare costs continue to go up, you can hopefully appreciate the fact that something has to be done. We have programs in place to work with churches on stewardship and other things to try to enhance the revenue base, but with declining memberships, not only in our conference, but denomination-wide, it's just a real tough challenge to generate any more funds coming out of the local churches. And that's the only place the conference gets its money. So that's a fact. 2 years ago, when we changed the retirement plan, you'll recall we had a petition that made some changes. And yes, we're coming back again, as you'll see in a little while, with another petition. And the reason we're doing it this time is that what we're going to share with you today, the plan that we're proposing to you for consideration, was not available 2 years ago. That's how dynamic and changing the healthcare industry is, and how dynamic the issue is in terms of programs that are available. 2 years ago, there were 2 conferences in the U.S. denomination that had entered into the plan that we're talking about today. Since that time, currently 6 other conferences are doing exactly what we're doing here, presenting it to their retirees to come from HealthFlex into this new Extend Health program. So we're not the only one doing this. We have some base of experience from a couple conferences. We have other conferences, again, who are doing similar actions with us. And the thing that you'll find is that historically, HealthFlex has been a plan that everybody has to enroll in. It's a one-size-fits-all, so to speak. As you'll hear today, the proposal we're making is that you will have an opportunity to identify and select the health plan from a variety of selections of carriers, a health plan that is most specific and useful and cost beneficial to your particular medical and healthcare needs. There's not one of us in this room who probably takes the same prescriptions exactly or has the same physical conditions, whatever. This program, as you'll see in a few minutes, will allow you to get away from the one-size-fits-all to go to an option which will allow you to select it based on your particular and or spouse's conditions. When we sent out that survey, there were several things that came to light. One of which was, well, if we change plans, what about pre-existing conditions? That will not be a factor in what we're proposing today. If we change from HealthFlex to what we're proposing today, pre-existing conditions will not be an issue for you. You will be able to enroll in any carrier plan, in any type of plan that you want. Now, the one caveat to that is that when you enroll in a plan under this new approach, subsequent to that, then pre-existing conditions will apply. So as you'll hear later, as you become educated and be able to talk to counselors and advisors who will work with you to identify the best plan for you, you want to make sure and look at that to make sure that you're getting a plan that is going to be good, because just like any other plan, it would be just like in HealthFlex if you're changing something else that's not unique to what we're presenting today. Pre-existing conditions will apply on that second change. So again, the primary point is if we make a change now going to this Extend Health, pre-existing conditions are not an issue. We're going to show you at the end of the presentation a website that you can log on to and a phone number that you can call to talk to a licensed representative from Extend Health who will spend 30 minutes with you or will spend 4 hours with you talking about your specific healthcare needs and what your circumstances are. For example, you could look at plans that pay a higher premium, which have low copays and deductibles, or you could look at plans that provide a lower premium that might have higher co-pays and deductibles. But they'll spend a lot of time with you, and so that's the other thing. We'll provide that information to you. In addition, we'll have, like I shared earlier, a place on our conference website that you can log on to, ask questions, we'll respond back. Everybody can look at those as they need to. What we're going to do is the conference is going to fund, or in other words, the conference is going to pay into an account on your behalf a certain amount of money each month. And it's called the Health Reimbursement Account, HRA. You will no longer have premiums deducted from your pension check, nor will you, for those of you who send a check into the conference office each month, you will not be doing that either. Because right now you're having those payments deducted, or you're sending the check in for HealthFlex premium payments. You will no longer have to do that. And again, once that is done, at the same time, the conference is going to establish an account for you, this health reimbursement account, where we're going to put some money into it on your behalf, and you'll see the details of that in a minute. A health reimbursement account is a tax advantage plan in the sense that the money that we put in to those accounts on your behalf are non-taxable. You're going to get that money tax-free. Okay. Next one. If we move to this plan, those funds will be available in your specific account effective on the very first day of 2013. One of the unique features of a health reimbursement account is that any monies that are unused in a given year automatically roll over to the next year. So, for example, if in 2013 you have a very good health experience, no major catastrophes or anything, but you've paid your premiums and you've paid some of your co-pays and deductibles, and you have some money, let's say you have $750 left in that health reimbursement account at December 31st. What happens automatically, that $750 in my example rolls over to 2014, and you have that in addition to what the conference will contribute in that year also. So it's not a lose it or use it type of issue like some plans are. This is a automatic rollover and you never lose the money. The other point for spouses, it's a joint account. Either party can draw from that account, okay? As far as reading the Rocky Mountain Conference eligibility, all of you meet the eligibility rules, okay? Since this is a new program, your Conference Board of Pension and Health has built in two safety factors for us as a conference and for you as a retiree. The subsidy levels that will be initially provided will be reviewed every 2 years. We recognize that healthcare costs continue to go up. That's why we're sitting here today, okay? So any subsidy amounts that we initially identify that we're going to provide to you naturally would have to be reviewed. And so we've structured into this process. Every 2 years, there will be a review and an appropriate adjustment made for medical health care inflationary costs. The second component that we're providing a safety net for is the conference will establish a safety net, safety net fund. We recognize that as much as work as we've done and as good of conversations you have with the people at Extend Health, there are always going to be situations where outlier situations occur, major surgeries that weren't anticipated, and other factors like that. We're going to build in a safety net. We're going to establish a fund of $50,000, $100,000, we haven't decided yet, to provide for the case where an individual or individuals may incur totally unexpected costs, medical costs, that were outside the realm of any considerations that were being given. So those are the two safety nets, the every 2-year review and the establishment of that safety net fund for outlier conditions. Let me give you an example of how this works. How many of you sitting here are pre-82 with more than 20 years of service?
Before 82?
No.
20 years before 82?
No, 20 or more years of pre-82 service. Okay? All right. This is for you. Okay? As we said, what we're going to do is we're going to eliminate the payment you're going to have to make, you currently make to HealthFlex, either through pension deduction or check to the Treasurer's office. So obviously the amount of your pension check is going to increase by that amount. But from your personal standpoint, you're going to be saving $120 every month, because that's how much you're paying. You're paying 25% of the total $480 cost, okay? Each month, the plan that you have has a total cost of $480. Your 25% of that is that $120. Everybody with me? Okay, so you will not have to pay that $120 anymore. In addition to that, we're going to pay into your health reimbursement account on your behalf a subsidy of $150 every month. So in effect, the total savings or income to you as a result of converting to this plan for a single person is going to be $270. The total of the $120 plus the $150. Everybody follow that? Nod, yes, no? Okay, all right. Obviously, for a two-party plan, the amount just doubles, okay? So that's on the savings and income side. Now, what's going to happen as far as expenses are concerned? What we've done is in preparation for introducing this program, we have evaluated an extraordinary number of plan options that you're going to be made available to. And what we have done on this side of the equation, we have assumed the very high average amounts, because we want to be conservative. We want to make sure that you're going to be protected as best we can financially. So thank you. All of the costs here have tended to be on average on the high side, okay? So keep that in mind as we go through this. You're going to select a health plan from AARP, Secure Horizons, Kaiser, a variety of plans. There's going to be over 70 different carriers that you're going to be able to select from. The average high cost, monthly cost for a premium is $215. In addition, we have plugged in there an average of $30 a month. Is that what it is? Yeah. Okay. For a dental plan. Now, let me just digress a minute. Getting back to that survey that we did in last fall, one of the outcomes of that was very interesting in that about half of you said that you desired to have a health plan, or you felt that or a dental plan, or you felt it was very important to have a dental plan. And about half of you didn't really think it was necessary. So there's an example of, under this approach, those of you who want the dental plan will be able to enroll in one. Those of you who don't feel the need for a dental plan will not have to incur this cost. In addition, we've plugged in a $15 a month amount, high average, for vision coverage. Okay. Again, on the survey, some of you said that was important. A less number of you felt it was not important, so I think at our age, we all think it's kind of important. So if you total those high averages up, what does it come to? $260? Okay. What was the amount on the previous slide of the money that either we were saving or that we were going to contribute to the HRA on your behalf? 270. That's the $10 difference, okay? So again, remember, we've used high averages here, and we're trying to make this come out equal so there's no harm to the individual retiree. Again, same thing there. We used a single example. It would just be double for the two-party, okay? Okay, on the next slide, let's take a look at those of you who are pre-82 with less than 20 years of service. Currently, out of that $480 a month total cost, you're paying 50% of that premium, or $240. The conference is picking up the other half. That was one of the changes that was made in the petition 2 years ago. Okay, so same process that we're going to go through here for those of you who have less than 20 years of service. You will no longer have to pay or have deducted from your pension check the $240 a month health premium that is currently being withheld or paid. And in addition, for you, we're going to contribute an additional $50 a month in that health reimbursement account on your behalf for a total savings or income to you of $290. Okay? You followed me? Okay. Again, just double it for spousal coverage. Okay, then on the next slide, we're going to go through the same thing. You see the same figures there, because the plans that are available, it doesn't matter whether you had more than 20 or less than 20, it's the same plans that are available. But in this case, what's that, 260? Okay. And how much was the income and savings that we had on the previous slide? 290. That's where we get the net monthly savings, if you will, and or income to you, or surplus. And again, that can build up in your health reimbursement account, okay? So here again, just double it for the spousal coverage. Now, let me stop. Do you have any questions or misunderstandings about this process or how the calculations have been made? We're going to talk a little more about the reimbursement account, but do you understand the calculation process? Okay. What you're going to see before this session is over, we're going to show you some example plans that are available. And in fact, exclusive of prescription plans, in fact, what you're going to see is exactly what you just said. Some are going to be almost 50% of what we're paying now. This Health Flex plan that we're in now, what is it, 26 conferences are in it, Barbara? 29. There's 29 conferences that are in the Health Flex plan currently. And how many enrollees is that about? About 7,000. About 7,000, okay. Yeah. Extend Health has an enrollment of over 400,000. So through that mechanism and others, yeah, you're going to find that as a general rule, the premium costs for many of these plans are less than what we're paying now. That's one of the drivers of this that we want to present to you, okay? The question basically was, conference will have to vote on whether the subsidy can increase enough to support any healthcare cost increases. The answer to that is no. The reason we have to take this to our annual conference is that we're proposing a change of plans. But,
so who decides whether
okay, well, but let me just say, just as we do now when rates are announced, annual conference does not approve rates, okay? Your Council on Pension and Health does that, and that never goes to annual conference. The same would apply to this. the subsidy levels will never go to annual conference. It'll be determined by your conference board of pension and health. I know as a general rule that this is going to be more cost effective for retirees, okay? Coverage-wise, cost-wise, again, with the exception that there's no way I can identify or project what your prescription costs are going to be, and that's why we're going to suggest something to you later on. So what I'm trying to show here is from your standpoint, not the conference's perspective, but from your standpoint, this is the way we're going to start. And again, that's why we've built in the safety net every 2 years to acknowledge up front that we know unless something dramatic happens, that healthcare costs are going to continue to increase. And we're saying to you right up front that we're going to adjust for that on your behalf.
First of all, I'm thrilled to be here. I've been working with your conference for probably about 15 years, ever since you came into HealthFlex, and that's been a very long time. The other thing I want to share with you, and specifically relating to this slide, but also ongoing, if the conference approves having Extend Health, we will have implementation workshops for everybody in the conference with Extend Health representatives. So how claims are paid and how the HRA works, the resources available to you through Extend Health are covered much more in depth by the implementation workshops when Extend Health will be out in the conference in September. In addition, you will have an Extend Health representative at your annual conference. I used to be a conference treasurer benefit officer for 12 years in our Western New York conference. And I came to the General Board of Pensions 18 years ago this month. It was the birth of HealthFlex in 1994. But in my 12 years in Western New York conference, I loved working with our retirees. And I know concepts are very important. Why make a change? But you are only going to have a comfort level when you actually go into that website and look and see which plans are available. I asked the conference to put in your packet a copy of your benefit summaries that show you exactly what are your benefits today, because you can't really compare something unless you have something to compare it with. And not everybody knows all the benefits that you have in your plan today, so you can compare with the plans that are out there. It also will assist you in looking at the pharmacy pieces on the website, because as Wayne said, you all take different prescriptions. I've been in the website personally. First thing you have to do is put your zip code in, and it's going to start to ask you some questions, and you're going to have a series of medical plans to look at. You're going to be able to do some comparisons, but we know in HealthFlex experience that about 70% of the cost for caring for a retiree is pharmacy. So it's going to ask you, and have your pharmacy bottles there if you take medications, to put in the names. What prescriptions are you taking? And that will make sure it's linking you up with pharmacy plans that cover those specific medications. Some persons, in my case, I take one generic. I hear as you get older, your thyroid doesn't work as well. And it's one of the most commonly prescribed medications in all of HealthFlex. So I didn't have a lot of really good information to put in there. But there are some people who take brand names, some people who take quite expensive medications. This gives you the opportunity on that website to go in there, put those medications in there, see what the pharmacy plans are that are available for your specific needs, and then know what the costs are. It also gives you some tools to communicate with the conference. I have a concern because, or when you get to annual conference, to have access to those Extend Health representatives from a personal basis to say, this is what I'm seeing with my own specific plan, and so I have a question, how does this really work? I think personally, the day I retire, I expect the general board, the only plan is going to be available through the general board is Extend Health. Because we have enough conferences shifting right now that we don't think we're going to have enough lives left to continue to maintain a companion plan. See, it's projected right now at 2014, possibly 2015. So when I'm ready to retire, that may be my choice. What I know is that when I'm going from a group to a group, which you're all doing, the law says there are no pre-existing conditions. We also know that the Affordable Health Care Bill, which is right now at the hands of the Supreme Court, we don't know what's coming out of that. And we should know by June. Whatever comes out of that is going to exclude pre-existing conditions. So it won't make any difference going forward after I'm Extend Health and I want to change 3 years down the line. Pre-existing will not be a factor, but we don't know that for sure. So what I determined, if I had to do it today, I don't know, I'd probably pick the best plan I could that I could afford. So I'm protected for the future. Because it is true that you're in Extend Health, say 3-4 years, you're in what's called now an individual plan. And if at some point in the future you want to have a much better plan because I have conditions that I need better benefits, then the cost could be higher or pre-existing could take effect. And that kind of dialogue is handled much more extensively during the implementation workshops and also in the individual conversations you're going to have with Extend Health licensed benefit advisors. So let's talk just a little bit about what's been happening in the denomination, why are we where we're at right now, what is Extend Health, how does it work, and what you should be doing personally before you get to your annual conference. About 5 years ago, the Missouri conference determined that they wanted to move in dialogue with their retirees to a similar model. They wanted to give each retiree a certain amount of money, and they wanted it set up as a health reimbursement account. Now, why a health reimbursement account? A health reimbursement account allows your conference to pay monies that you may use for premiums for a medical, pharmacy, dental, vision plan, or to use for any expenses you have. If you have co-pays or you have deductibles, a health reimbursement account can be legally used as a tax-free benefit to pay for those kinds of costs. If the conference just sent you a check, it'd be taxable income, and then you'd have to do your adjustments on your own income tax. So the conference, through Extend Health, will have a health reimbursement account in everyone's name that they will be putting monies into that you can use for premiums or other expenses. Now, when the Missouri conference faced this, they had to hire what's called a third-party administrator to handle the health reimbursement accounts, legally do the filings that needed to be done to keep them legal and tax-free. They had to work with all of their retirees to help them to see what was available in the market and to make the transition. In 2010, the Yellowstone Conference, your sister conference here, I happened to work with them as well, they wanted to move to the same kind of model where they were giving monies to each of their retirees, and much of that was being prompted by retirees coming to the conference saying, we've done some research and we can get plans on the market that are cheaper, or we'd rather be with this company rather than they have Blue Cross Blue Shield. Extend Health was not an option within the general board at that time, so Yellowstone had to do the same thing as Missouri. They had to hire a company to handle their health reimbursement accounts so that there would be a tax-free benefit for their retired. In the meantime, two non-Health Flex conferences, two large conferences, Iowa and the Indiana conference, said, well, we need to get more help for our retirees And so they went to Extend Health, which is a company that started in 2004 for the express purpose of helping retirees who were trying to choose a medical or a pharmacy plan that would best meet their needs. Extend Health is the largest company for what we call an exchange or an individual Medicare program. That's all they do. They have 400,000 participants. They have 70 carriers like Blue Cross Blue Shield, United Healthcare, Secure Horizons, Aetna, Humana, that they've contracted with and represent, so that when they have conversations with individuals, those carriers are all available with their different plans. AARP's another one, which can be very complicated when you're just trying to read all their material and make a decision. Conferences began to come to the General Board of Pensions and say, you know, we'd like a model to explore like this, and all you have for us are the Medicare companion plans and the Medco pharmacy plan. We'd like to have an opportunity to work with our retirees to see if setting up an HRA and letting them choose their own plan would be an option. So beginning in 2012, the New Mexico Conference and the Northern Illinois Conference, through work with the General Board of Pensions, have now moved all of their retirees to Extend Health. And in our first survey with them, there's a 92% satisfaction level. This year, for 2012, already the Baltimore-Washington Conference has determined they're moving to Extend Health, and that decision was made at the Board of Pension level. They didn't need annual conference action. Going to annual conferences for a vote on moving to Extend Health this year are the Dakotas Conference, North Georgia, South Georgia, Central Texas, Northwest Texas, and Rocky Mountain Conferences. The Oregon-Idaho Conference is also moving, and the Upper New York Conference. So that's why we're projecting that by 2014, possibly 2015, there won't be enough lives left in the traditional companion plan that we currently have in order to keep it sustainable. So that's why we're bringing to you and to your board at this time the option for looking at Extend Health program. Now, are there any questions on what's actually happening right now? Okay, the question is, who's absorbing the cost for the services that Extend Health is providing? First of all, they have contracts with these providers. So you take a Blue Cross Blue Shield, it's much easier for Extend Health to have licensed benefit advisors, which they do, which you will be individually talking to. If the conference determines they're going to Extend Health, we will have the implementation workshops here for the discussions about enrollments, all the options and enrollments. You will be setting up an appointment with a licensed benefit advisor at Extend Health. They are trained in the Extend Health University. They do not make commissions, so there is no benefit in them suggesting Blue Cross over United Healthcare. They're just there to make sure you have all the information you need to pick the best health plan. So a Blue Cross Blue Shield, a United Healthcare will give money to Extend Health to do all these services that would be hard for them to do individually. The conference will be paying $3 a month per person to the General Board of Pensions for the administration of the health reimbursement accounts, and then that money will go to Extend Health. So the administration of the monies coming in and going out of the health reimbursement accounts is the only charge that will come back to the conference for that. Does that answer your question? Okay. The licensed benefit advisors are probably one of the most important things to you. Extend Health works with groups like your group. They also work with large companies. They work with Chrysler, Ford, Avon, Eastman Kodak, multiple companies that say we're giving our retirees monies and we need somebody to help them. In some areas, Office of the Agings are helpful. In some areas, SHIP's program is helpful, but it's not universal. And just as our conferences and these companies care about their retirees, they want to make sure that who's ever talking to them has extensive knowledge about health plans and pharmacy plans. So Extend Health will provide that service through their licensed benefit advisors. Extend Health is also adding additional carriers, negotiating contracts with them, so they'll be able to offer those plans to you as well. They offer the AARP plans. Medicare is primary, just as it is for you today. They have what they call a supplement plan. We call it companion plan that you can add on. So Medicare pays first, and then the other company pays secondary. For those of you in Secure Horizons, they also have the Secure Horizons programs. For anybody concerned, I don't want to have to change my doctor, you don't have to change your doctor. As long as your doctor is accepting Medicare with your current plan, you will also have access to the same plans, so you could keep your doctors and nobody has to be concerned about losing their doctors. Okay, any questions on the types of plans or the different vendors? It is dependent on your zip code. So that's why it's important with that website, and also the toll-free number there. That's the very large customer service department at Extend Health, which will be happy to answer any questions you have if you're not comfortable with computers, or if you're having any difficulty navigating around their screens. The toll-free number customer service people. When the General Board chose Extend Health, one of the things we did was go out and visit them. We actually sat there and listened to them on the phone, talking to retirees. Sometimes the phone call was 2 hours, 2.5 hours, half an hour, 4 hours, just depended. So there was no rush. There was sensitivity to some people who might have felt a little anxious about making a change. Very thorough. So that's one thing that will be discussed in the implementation workshops. Make sure you have every piece of information on your medical needs and on all of your pharmaceutical needs so that they're aware of it. And also any questions you may have about if I change my carrier, the pre-existing, they keep up with the laws, as they're changing and possibly changing more under this Affordable Health Care Act. Donna, I know, has done extensive research at this website for all of your participants, and I think she's even produced some different kinds of reports that show everybody had coverage. In the greater Denver area, it was a very extensive types of number of vendors that were out there. I happen to live in the greater Chicago area, similar to you in what I call the greater Denver area. And it just scrolling up all the choices that I would have, and then I had opportunity for plan comparisons. But unlike Missouri, nobody's going to have to do that all by themselves. They're going to have the licensed benefit advisor that's going to say, based on all your medical and pharmacy needs, here's what plans look like you might want to consider. And so you're going to have that additional assistance other than the website, but we thought you all might feel a little better if you could actually go in there with your personal zip code. Wayne is probably going to talk to you a little later about input that will come to opportunity that you can have for input to the conference through multiple conversations that are available through their website on a blog, which will let you see comments and answers to questions retirees have, as well as I'm sure Don Sperber or Wayne or Dave Lilly, your board chair, all of them want to know, what are you finding? Is it look good to you? I'm sure they're happy to receive all kinds of favorable comments as well as questions or any comments that you have, so that as they move into annual conference, you'll all feel maybe a little less anxious about the unknown, because today this is our first meeting and it probably does feel a little bit like the unknown. We don't want that to happen. I will say there's great need today with retirees for assistance, and probably Paul Ryan has developed a plan that's of assistance to those who need help.
Get so much and go out and get your own insurance. That's the plan, basically.
Yeah, well, this plan is similar. It is that you'll get so much and you will be able to get your own insurance. The plan is probably a little different in that the conference has done a lot of research. The General Board of Pensions has done a lot of research, and we would not have brought Extend Health in if we did not feel comfortable with them, and we will have ongoing work. In fact, the surveys that have already been done with New Mexico and Northern Illinois, we are personally doing a much more extensive survey, because now people have been in the plan 4 months and we want to know exactly what's happening. But the conferences are very in a lot of communication and very concerned that it's a good experience for the retirees. And so far we've only been getting favorable comments back from the benefit officers from those 2 conferences. Yes, in the back.
When can we begin to access this website or use the phone number to gain assistance?
The question about when can I begin to access the website, it's up now. It is available. In addition to your going into the website, I did mention the blog, and maybe this would be a good time for Wayne to share how you can actually look and give input as to what from what you're finding for the conferences.
Barb, thank you. One thing I thought of as Barb was talking, a question that was posed to me yesterday was, is this a done deal and you're just sharing this information just for information purposes? The answer is no. We have waited until after yesterday's and today's meeting to finalize the petition, which is ACO1, which we will post up on the conference website next week, where all the annual conference petitions are posted. We still want to look at the subsidy levels that we've talked about today, okay, number one. And number two, as has been stressed time and again, we want the feedback from you, because as the petitioner of this proposal, the Conference Board of Pension and Health can make any changes up to the point of when it's officially received by the annual conference. So we're going to post what we have now. We're going to integrate feedback and things, but there may be some changes to it before it actually goes to annual conference. So is it a done deal? No. But you have heard the experiences of other conferences. You've heard of what possibly is going to be the situation with our current Health Flex plan by 2014. We're trying to stay ahead of the game here, and we're trying to make sure that we're able to continue having a plan for retirees irrespective of financial situations. So
The only way you can enroll in Secure Horizons, if the federal government has given authority to Secure Horizons to provide coverage for persons who reside in a particular zip code. One of the questions that will be asked is how much time you spend away from home, or the licensed benefit advisors will want to know if you're moving, because there may be different plans available in a zip code where you may be moving to, especially the Advantage plans, because as you know, even in your own conference, everybody doesn't have access to Secure Horizons. It's strictly driven by the zip code where you live. The other thing, though, you put in your zip code where you live, and and say you decide to enroll in United Healthcare's AARP program, you don't have to get your care in the zip code you just put in. It just says AARP is available for those who live in all of these zip codes, or for my own zip code. We know United Healthcare AARP program is across the country, pretty much. So it doesn't mean you have to get your care in that zip code. It just means they write the AARP, United Healthcare program, in the zip code where you live. And that's in most zip codes, but it's not in every one. So that's why it's important for you to look at your zip code. Yeah, the question is, will any pre-existing condition you may have now affect a choice? So you go into the website, you put your resident zip code in, and let's say 13 different providers come up. You have access to all 13. So no matter what your health conditions are, it doesn't affect
It's just the
choice.
next time that it might be a problem.
That's correct.
Okay.
Just to double check, Barbara, the law you're talking about is law outside of the affordable care.
That is
Moving
correct.
from group to group is not dependent on the affordable care.
That's correct.
All right.
Okay, what I'd like to do, I'd like to ask Don Sperber to come up to share with you a few words. As I indicated earlier, Don is your retiree representative on the Conference Board of Pension and Health. And Don, come on up here a second.
I want to, first of all, say, along with Wayne and others who have said, we're grateful for your being here. One of the things that I can say is that it's been over the last 3 years that we've been wrestling with these kinds of questions. And some of you who know me with the fact that we get together once a month have heard me consternations over this whole issue. But I want to say also that Russ Brown is one of the persons who was on the task force that was brought together in the conference for purposes of doing some of this study. It was then pushed to us and the Board of Pensions to try to make a decision around it. One of the things that I want to just quickly share is that a year ago, about this time, when we were beginning to look at these kinds of questions, we who are retirees have gotten all this mail that keeps saying you have opportunity to sign up for your Medicare at a different location and by this time. I decided it was worthwhile to take time to spend time going to one of those briefings in order to try to get some feel for what it really meant. I went to the ARP one because it indicated that it was United Healthcare and Secure Horizons. I began to look at our plan and that plan together. But what I found is that there were so many options that I began saying, golly, this is so much less expensive than what we're presently paying. And if I were to have been willing to do a change myself at that point, it would have saved the annual conference $780 a month, and would have been a possibility for me to be into a plan very comparable, I wouldn't say exactly the same, very comparable to what I already had. The reason why I decided not to do that was because we were not sure where we were going with this, and I knew that if I opted out, then whatever the decision was at annual conference would mean that I was out of the plan. So I'm excited personally about what I think this means for us. I don't think that it's a panacea, but on the other hand, when I looked at what we were doing and our plan, in contrast to what they've done in Yellowstone and others, we have much more of a safeguard and a safety net than do they. What I feel strongly about is that yes, there are going to be some ways in which what took place or is taking place in the Supreme Court will impact what the national plans are, whatever that is. But as we looked at this and began seeing what it really meant for us, we could have delayed, and we initially looked at delaying until 2014 instead of 2013. But because of where everything seems to be at this point, we felt that it was best for us to begin to make the plan to change by 2013. The thing that we feel strongly about is the need for this kind of opportunity for you to all hear the same thing that we've been wrestling with, to come to the point of feeling some comfort yourselves. Any time that somebody tells us, who have all of these years had our health insurance just simply provided, we didn't have to make a big question or decision about it. We had one or two that we made each year. The fact of the matter is, that scares us all to death. But I want to say further that I think the way this works with Extend Health, it will in fact be something that will give us good advice. We'll make decisions that fit us individually, and it will be a major savings to all of us in the church. So I want to say that, and I will be transparent to say that I was sitting on the board at the point that this question came and made the motion that we do what we're suggesting. I feel strongly that it'll make a difference, and it'll be a good difference for all of us.
Is it a done deal yet? No. You've heard, on the other hand, what's coming down the road. Again, what we're trying to do is stay ahead of the game here and be proactive and provide something that is going to be beneficial to both you as individual retirees and spouses and us as a conference. Go on this website, call this number. We'll be sending out to you, unfortunately we didn't have it ready to tell you that, but we'll send you the information on that blog for feeding back to us your comments, concerns, questions as a result of your interaction with this here. Again, we'll respond to each one of those. It'll be a shared site where all of you can go on to see questions and answers that are being raised, okay? As Don pointed out, we'll have an Extend Health representative there. We have 2 days over the noon hour. That's all we could fit in as far as the annual conference schedule, where there'll be information sessions available, and also at the legislative session where this particular petition will be presented, we'll have an Extend Health representative at that legislative session. So, go on there, let us know, lay it on us, and we want to make sure we're doing what's best for everybody.